there is a huge discussion, how can we use these biomarkers? Because, of course, plasma biomarkers can give us a lot of information. But again, their relevance at clinical level is definitely need to be confirmed against the CSF or imaging markers. Of course, imaging is important, at least structural imaging, to be performed in all patients, because we have to exclude a lot of different causes of cognitive impairment. But focusing on pathology and neuropathology, we need to evaluate the value of single markers and also the validity of single marker for the same subject performed in different conditions. So the solidity and the robustness of the new markers performed either with the Simoa or with Luminex or different platforms is quite fair. We know that there are some conditions which increase the levels independently from the cognitive impairment, for example, kidney dysfunction or even probably the diabetes. So probably we need to adjust the cutoffs for such conditions. But what I think is still lacking is a current application of biomarkers in larger samples of not selected patients with unclear diagnosis, in order to test whether these markers can improve the diagnostic process, or can even substitute the CSF in some very clear cases. I don't think that. So if one subject resulted high positive or high negative, for example, for 2 or 3 p-tau markers, then it's clear. And if we are in an unclear phase with 1 positivity, 2 negativity, or such combination of cases, then probably we need again CSF to be sure what we are looking at.